Hey everyone, I'm Morgan, and we're going to be discussing modality integration today and kind of learning about my thought process on integrating modalities together and kind of my thought process for treating animals. So, we're going to focus kind of on horses today, and I have a little agenda. I'll give you guys a little bit of who I am and an introduction, my favorite modalities and why, myself as a practitioner, how I pair the modalities, and then we're going to kind of put it all together. So, again, my name is Morgan. If we haven't met yet, I am the instructor for acupressure, advanced myofascial release, raindrop therapy, and animal cupping therapy, and then also the teaching assistant for basic horsemanship, pet first aid, and then I kind of um, like teaching aid or assist, I guess, with the aromatherapy courses, the equine therapeutic exercise course, and then also because I've taken all of pretty much most of the holistic animal studies courses, um, I often will help students out with other things as well, like the cold laser therapy course, kinesiology, kind of wherever, and if I am ever needed. Um, I have been kind of creating courses with Dr. Angelique since 2024, so not too long, but have really brought some amazing modalities to holistic animal studies. I've also learned a lot along the way. I'm certified through holistic animal studies as well. I took a lot of my um, initial certifications with holistic animal studies, and then I further educated myself along the way. So I kind of listed there what I'm certified in with holistic animal studies, and then I hold additional certifications with other institutes in massage, kinesiology, taping. I have my acupuncture diploma, my vet tech diploma, and then I've done a lot of continued education courses, just learning about different modalities. Um, I have plans to finish my neuromyofascial release. That one's really interesting. I really would love to finish that course and get certified in it because I have seen how well that modality works, and am very interested in finishing off my certification with that one and whatever else kind of pops up along the way. I've been working with horses holistically for about 6 years now, and I began actually with my equine nutrition certification. And a little backstory on that is that I bought my first horse actually quite old in my life. As a horse person, I've been riding since I was 10, competitively, in the English hunter jumper world. And where I kind of grew up riding horses, I was fortunate enough that we got to ride like lesson horses and horses that we kind of were able to train and show on our own as we kind of got older and we were teenagers, I guess. So I didn't need to buy a horse for a majority of my teenager and young adult years. So I actually didn't buy my first horse until I was 20, and I bought an off the track thoroughbred actually from a show barn that we often showed at and clinicked at. And, anyways, owning my first hard keeper, that's what sparked my actually finding the holistic equine nutrition course, what sparked me starting a more holistic mindset, and then what sparked me obviously starting my journey with holistic animal studies and becoming certified in modalities and starting my business. I kind of always had plans of being a vet tech and doing equine body work on the side. I just didn't kind of know what path I was going to take or how I was going to get there. So it kind of, everything happens for a reason. So that's kind of where I started. Over the years, I've developed a really deep passion for helping owners and practitioners to like understand the connection between the body, mind, and energy. Um, I have my logo or my slogan is helping your horses, helping your equine partner from the inside and out, because my focus is on nutrition and kind of that internal stuff and also the external stuff with like massage and other modalities. And I have found a passion for teaching. I love teaching everybody about modalities. I love talking to people about modalities. I love teaching clinics, and I love teaching owners as well, so that they feel empowered as to be part of their animals, essentially their animals' well-being, a part of their treatment. So as I've devoted much of my time to ongoing education and hands-on learning, I've come to truly appreciate how beautifully interconnected each modality is. I often say that every technique peels back another layer of tension, allowing us to reach deeper levels of balance and release within the animal. No single approach stands alone, and they all complement one another in restoring the body's natural harmony. So you'll often catch me saying that we're peeling back the layers of tension. Each modality offers that. You kind of start off in one layer and you work your way down to another layer. In this presentation, we'll be exploring several real-life case studies with names changed for privacy and that I've encountered over the years. We're doing two. I'll walk you through my treatment process, including which modalities were used, why I chose them, and when they were applied within each session. The truth is that in my day-to-day practice, whether we're talking equine or small animal, I often use multiple modalities together. I mean, there's a lot of modalities that you can use together. Oftentimes, we use each one to amplify one another. So, example is you start with massage and you kind of end up, you can do cupping, you can do red light, you can do kinesiology taping, any of those. So on the next slide, I'll kind of introduce the modalities, and you can kind of understand my approach to holistic treatments. But obviously in one session, kind of going back to that, in one session, I sometimes don't have time to do everything, every single modality, and sometimes there is a point in which you don't really necessarily have to. There obviously is cases of doing a little bit of a system overload. Animals only have so much patience, and also you only have so much time as a practitioner. In my personal business, I offer each modality on its own when applicable. So there are some instances where I think that, if someone were to book me for just a kinesiology test taping session as a new patient that maybe has not had work done for their horses or their dogs in like months or even years, or if at all ever, and I go out there and the animal is like just really tense and they've got a lot of things going on, I will tape them because that's essentially what they hired me to do, but I will educate them on why they need more than just kinesiology taping. At the same time, we have a plethora of equine body workers in the world and obviously in different areas. And sometimes when you offer different modalities, you have the ability to kind of act as a referral. So I have had certain practitioners refer clients to me for my specific modalities that I'm certified in, such as cupping and red light and kinesiology taping, because perhaps they don't have that education. Perhaps they know like how that's beneficial for that patient, and they think that the horse or the dog or the cat would benefit from those, but they're not certified, so they can't offer it. And so that's kind of where offering those modalities can really come into a positive effect on your business too, because you can help people's animals obviously in those instances. So then in that case, if someone is booking me for just kinesiology taping and they do get regular body work done or whatever, then oftentimes it works out really beautifully that we kind of all work together. And that goes for a lot of different modalities as well. So this course will cover a lot of what each modality is probably in this flow course. I personally haven't taken a look at it yet, but it should discuss kind of how the situations and the cases that it can be integrated with. But I'll share my perspective and my thoughts as a practitioner. Um, This is both educational and insightful, helping new and seasoned practitioners hear a different point of view. That's the intent of this course. It's not to teach you a modality itself. It's not to teach you specifics. It's kind of to teach you about kind of modality integration. But the most important thing that I like to remind my students and other, even just owners, is that not one size fits all in bodywork. Modifications are often routinely needed when you're dealing with chronic cases. One horse or one dog that presents with one issue, and then, maybe a week later you have someone with a very similar one, you might not have the same treatment plans. So it's kind of, you have to take everything with a grain of salt, and I feel like having an open mind and learning the most that you can as a practitioner really is beneficial when you're putting together customizable treatment plans for your patients. So to get into sort of the modalities that I use, and kind of just to start us off, is assessment and palpation. They're not really modalities in themselves, but I don't ever begin a session, even if it's a repeat client, without some sort of hands-on evaluation. This process is crucial, so this is not only for identifying areas of concern, but also allowing for me to connect with the animal on a deeper level. I'm not immediately jumping in to manipulate or treat. Rather, I begin by placing my hands on the animals to feel, listen, and observe, which is super, super important as a holistic practitioner. This initial contact sets the tone for the entire session. It gives the animal time to process my presence and intentions, helping them relax and understand that this interaction is safe and beneficial. For some, this stage may take only a few moments, and for others, especially sensitive or anxious individuals, it can be a slower, more deliberate process. So what I mean by that is, if I am rechecking a client and I'm not doing a full in-depth analysis, which, when I'm doing an in-depth analysis for a new patient, that's why my new patient sessions cost more, because it does take me some time. It can take me anywhere from a half an hour to 45 minutes for a full analysis. And this can depend too on the actual presenting complaint. Again, this is sort of more based on my equine practice. My equine practice is much larger than my small animal practice. Equines obviously just take a little bit longer because we're typically doing a lot more. They've got bigger bodies. You're probably assessing saddle. You're probably assessing tack. You're probably getting them to walk, trot, run around, all of the sorts. And you're often having a conversation with the owner at the same time too, as well, discussing about what they think, is what their presenting complaint is. So yeah, but even if I have repeat clients, I still have, dogs that are a little bit more reserved, cats that are very stoic, and horses too that are um, just emotionally not always available. So that's kind of where it can take some time. Sometimes it's a quick assessment, a quick palpation to see, okay, what's coming back, and repeating itself is the biggest thing that I'm concerned about. If it's something that's coming up, maybe that's something new, that's not always a bad thing. It can mean that what you've released has uncovered something else, kind of going back to the peeling back layers of tension. And yeah, if you have a more anxious animal, if you have a more sensitive animal, you're probably taking your time doing those assessments. You're moving a lot slower. You're giving them breaks, stuff like that. Before the very first appointment, new patient appointment, I always have owners complete a detailed medical questionnaire and consent form, similar to what you'd fill out in your own doctor or dentist office. This encourages owners to take time to reflect on their animal's history, behavior, and any changes they've noticed. It also provides me, as the practitioner, um, the valuable insights into what the owner is observing, though it never replaces my own assessment. Instead, it helps me focus my attention where it may be most needed. So sometimes when you're assessing a new patient, um, the biggest thing that I like to do is have them fill it out ahead of time, because they'll often do it when they're sitting down, or at the end of their day, so they've got some time to kind of reflect on what's been going on with their animal. It allows them to kind of really think about what's been going on and answer those questions a little bit more in depth. At the same time, I only have open-ended questions. There's a few yes or no's because we are kind of dealing with animals, so of course there are certain details that are just simply yes or no. But I do provide a lot of open-ended questions. So the owner has to answer them in a manner, and then it kind of can trigger that thinking process of, oh, well, Fluffy has been, not drinking as much lately or not eating as much lately, and kind of gets that flow going. I take this a lot from my vet tech background, because when you have an animal that presents to a hospital with multiple symptoms, you ask a lot of open-ended questions because it gets the animal's owner to really think about their response and to answer their response a lot more thoroughly. Not just, did Fluffy eat today? Yes or no. How has Fluffy been eating throughout the day? Well, she hasn't been eating in much in the morning. She eats more in the afternoon. And then she's, oh, but in the last few days, she hasn't been eating at all. It kind of goes into that, right? Um, so, anyways, this initial consent form questionnaire, it allows me to see what am I going to be going into? What am I going to be focusing on? It also allows me as a practitioner to just get a little bit more organized, truth be told. It allows me to really select what sort of modalities I might want to do, and it helps me put together a treatment plan ahead of time. I'm a little bit organized and controlling that way, where I like to know ahead of time, and that's something as a practitioner I had to teach myself very quickly, because it was very much something that I really wanted to prepare for every session ahead of time, so that I always felt really confident, and that I always felt um, like I knew I was only going to be an hour. I knew it was going to be longer. But truth be told, when you go and see an animal for the first time, things can change. But I still like to have that initial kind of preview of that animal, so that I do know, okay, I'm probably going to incorporate cupping. I'm probably going to incorporate acupressure or something along those lines. So here's a little example. If an owner mentions that their horse has recently begun bucking under saddle, that note immediately informs part of my approach. I certainly always evaluate saddle fit with horses, especially when they're presenting with back pain. But I'm also going to do more. I'm going to assess their pelvic alignment. I'm going to assess their psoas muscle, their sacroiliac region, their SI region, and some other regions, right? Because that's bucking is not just always from the saddle. The saddle could fit great. The saddle could not fit great, and that could not be the problem as to why the horse is bucking. It could be something different. So that's kind of why. So what does an assessment and palpation look like in my practice? I work methodically from head to toe, literally, to ensure that I don't miss an inch. Oftentimes, when you're starting your palpation and assessment, because you don't want to be wasting kind of any time, to put it in, to lack of better terms, but you're often talking to the owner. You might be kind of talking to them about personal stuff. You might talking to them about what's going on with their animal. So if I work head to toe, it just makes sure that I'm not missing any key areas along the way. My process, it blends palpation, range of motion testing, and reading the animal's body language. The eyes, in particular, tell us so much. Animals don't have a way of hiding their facial expressions the way humans can, but as prey animals, they can conceal pain or weakness. But their eyes often reveal subtle clues, softening, tightening, blinking patterns that communicate discomfort or release. That's a really, really big one that is really important to remember, is that no, animals don't necessarily have facial expressions. We think they kind of do, right? There's some belief that maybe there is a little bit of a facial expression. Obviously, a dog has the ability to pant and kind of look quite happy at you versus looking at you with kind of a frowned face, closed mouth, not as happy. But then you look at cats. Cats often don't have facial expressions. They kind of look at you, or that's it. That some cats, they have like those naturally like grumpy faces, like Grumpy Cat. um, but their eyes. Their eyes are what communicate with us. And when I am working on a horse or a dog or a cat, I'm constantly ensuring that whatever I'm doing, I have a method of looking at their eyes or a way of seeing their eyes and seeing what's going on, especially when you're working on animals that are quite stoic. You have certain horses, personalities that are very stoic. They don't want to release, they don't want to show you a lot about what's going on. You also have cats. Cats are very stoic. They are notorious for hiding what is wrong with them. That is literally their most well-known trait. Um, and so, yeah, so that's kind of a big thing. So I begin at the head, assessing TMJ function. I palpate both sides for tension and symmetry, gently encouraging jaw movement to feel for restriction. That's often something that we found in horses very common. I'll assess the hyoid in this area as well. Then I'll move up to the pole, also palpating, checking range of motion, progressing down the neck, assessing for tissue tone, heat sensitivity, gentle range of motion checks along this area. By this point, by the time I've kind of done the neck, I usually have probably even gotten a release, usually, depending on the animal. And now the animal has started to sort of be like, okay, this is what we're doing. I'll continue into the pectoral region, shoulders, withers, abdominal muscles, back, lumbar area, glutes, stifles, hamstrings, and then I will go back and I will do the full front limb and full hind limbs, assessing the knees, the fetlocks, the stifle, making sure I'm checking all those major joints, also checking the fluidity of movement. So after that, I might check for movement, and then I also might assess for movement. So range of motion checks are, usually sort of manipulating the joint in a certain way or something like that. For shoulders, it might be adduction and abduction, seeing what kind of degree of angle that animal can pull their limb away from them or pull it in closer to them, seeing how tight that is. And then also just like fetlock circles. That whole process also starts to simulate blood flow because you're moving things, you're stimulating things, you're putting your hands on the body. So you're already starting to increase blood flow. You're already starting to kind of warm up the tissue, make it pliable to what you're about to do. Now getting into massage, which I call my foundation to anything. Truly. If you, first of all, usually most certifications you probably won't want to do until you're certified in massage because most certifications additionally on top of massage are kind of more of continued education. The only one that you kind of usually get away with that is like something like acupressure because it's just it's kind of like a different modality in itself that you could be strictly a traditional Chinese acupressure practitioner. I do know some who do that route. Our courses are set up to be that way, but a lot of times massage also allows you to be eligible for certain insurances and stuff like that as well, just because of that's just how our systems are set up currently. But anyways, massage truly forms the foundation of everything that I do. Almost every session I offer includes some form of massage because it's one of the most effective ways to begin communicating with the body and preparing for deeper work. That could be as simple as a meridian massage. In my acupressure sessions, it can also be a warm up or lymphatic massage prior to red light therapy. It's simply that massage is kind of just my foundation for everything. After completing my initial palpation, I'll typically begin to do like a full body warm up. So, this is where I use light to medium effleurage strokes along the entire body. My goal at this stage is to gently warm and soften the tissue, making it more pliable and receptive to change. This approach not only promotes the circulation and relaxation, but also allows me to observe the animal's responses. Again, kind of going back to the assessment and palpation side of things. There are subtle cues, shifts in breathing, or changes in stance that guide me to where they need me most. For some, this whole talk of intuitive aspect might sound a little out there, but it's really about being attuned to the animal's communication. I have a deep respect for energetic modalities like Reiki, but what I practice here isn't energy work. I'm not a Reiki practitioner. I actually know nothing about Reiki or animal communication or anything like that. The only energy I focus on is Qi energy in traditional Chinese medicine, which is a proven energy, if that can make sense. Again, I don't know a lot about Reiki. I don't have intentions of practicing Reiki. Um, I think that I think it's a great modality, but it's just something that I'm not currently in my stage right now interested in pursuing, only because I just have a million other things going on. If I had free time and I didn't have other things that I wanted to learn, I probably would. But anyways, my intention and my thing about talking about this communication and being attuned is that it's just being fully present and responsive to what the animal's body is expressing. Animals express very subtly, and they express in certain ways, and they communicate to us in a lot different ways than obviously a human can. So you have to be very in tune in what they do. Years and years ago, I posted this video on my social media, and I was just hanging out with my horse. It was an evening after work. I was relaxing with him, and I was kind of just doing a little massage in his paddock. I was actually still in my process of certification, so it was more so of me practicing, getting my hands on my horse. Long story short, as I was kind of doing things along, Baron kept coming around and pointing at his shoulder. And he just kept doing that. And it was his left shoulder. And I hadn't gotten to that area, I think, yet. I think I was kind of focusing on his hind or his back at the time. And so I listened to him, and I went to his shoulder, and I started to massage his shoulder, and he just left out the biggest release. He was yawning and yawning and yawning and yawning. That is an example of being in tune with your animal. I was in that moment probably not as in tune as I should have been. He had to show me, but by knowing like the horse itself, but also by knowing, okay, he keeps pointing to his shoulder, I'm gonna work on his shoulder. That's what I'm doing, right? The massage, sorry, going back to this, obviously. The massage techniques I incorporate during this stage are primarily foundational ones. So effleurage, compression, kneading, with the elements of lymphatic massage woven in to support detoxification and tissue health. These opening techniques set the tone for the session, helping both body and mind relax and creating a solid base for any additional modalities that flow. So these are the primary techniques that are taught in the courses, and something that I just start off with to kind of get things going. Then I start to get into myofascial massage, which is something that's kind of come up really popular in the last couple of years, is the fascial system and working more closely with fascia. And this is where I really start to get in tune with the animal in front of me. This is, feeling for the areas of really tight fascia, restricted movement patterns, hardened tissue. And these are the clues that tell me where the body's holding tension and where deeper work is needed. I kind of call it my going deeper, my next stage. I typically will transition into myofascial massage soon after completing the initial massage phase. This is very slow and steady work. It is very light, often not super deep, but it's working slow and steady. Simple as that. It is intentional and designed to gently unravel the next layer of tension beneath the surface. And just by doing the myofascial work, whether that, with the slow and steady, this actually allows us to go deeper than traditional massage. Whether I begin with acupressure or myofascial massage depends entirely on what the animal presents with that day. These are kind of the two modalities that I kind of will start off with before I go into other modalities, if that makes sense. So massage would be my foundational, whether again that's a quick massage or a more in-depth massage. And then when I go into like deciding whether this animal needs more advanced techniques with myofascial massage or whether this animal needs acupressure, it's kind of more so what the animal is presenting with. So is there postural issues? Where is the tightness? Where is the compensation patterns coming from? What is that animal's behavior? What is going on with their organs? What has the owner reported as far as those sort of things as well? I'll start with myofascial work to release the physical restrictions, and if I'm feeling something to be more systemic or behavioral or difficult to pinpoint, then that's when I will often go into acupressure and address maybe some energetic or internal imbalances before returning back to the fascia. We'll talk about that later. Myofascial massage, again, uses the slow, specific techniques that target the fascial layers rather than just the muscles beneath. This is one of the most important principles when you're starting out with this work, is to slow down. Fascia responds to warmth, stretch, and gentle, sustained glide, not force. A common technique that I use actually quite often that I never really realized until I put together the course and then started to really observe what I do most often is opposing directional sweeps. So if you don't know what that is and haven't been in the course, essentially I'm creating gentle tension in two opposite directions, encouraging both a stretch and a glide through the fascial web. This helps the tissue release adhesions and restore fluid movement between layers. So you're creating a glide. As you glide, obviously, your hands apart, but because it's with a little bit of tension in your hands as you're spreading them apart, you're also creating a stretch kind of in between your hands. I work through the body in sections, focusing on one area until I feel and see a release. Whether that's softening under my hands, a sigh, a look at you, or a shift in posture. It may not be a complete release yet, and when I sense improvement, I move on knowing I'll circle back. So the thing with myofascial massage and the fascial system is that it does need these specific things to rehydrate the fascia and to move the fascia along. But however, kind of one thing that does come up with fascia a lot is the connection. Fascia connects everything in the body. So when we're working with the fascial system, unawareingly, people who don't really study fascia, they're working with the fascial system, but they're not actually studied and well versed in the connection and everything in the body. So for example, this is a really common one and probably one that would make a lot more sense if you don't know what fascial work is, but essentially the pole connects to the hind end. When I'm starting my fascial work and I start on the hind end, and I get those releases and the tissue starts to feel more pliable. I feel like the fascia is releasing. That's great. I'm going to kind of move on to another area. And as I move on and I go through the body, because there's probably other things going on too, then I say I come back up to the pole. And the pole is really tight. And that's also another common area for horses to be tight in, is the pole. A lot of myofascial kinetic lines connect at the pole. A lot of meridians run across the pole. So I'm working on the pole. It takes me a while to release the pole. I get the releases. I'm going to circle back to that hind end because now that I have released something that connects to that area, I might actually find that that area has now wound itself back up, or that it is presented a little differently. Reason being is because as I'm trying to release the pole, because of the interconnection in the fascia, as I'm trying to release that fascia in that particular area, naturally the animal might respond by tensing up in another area. Okay? If So this is kind of explaining this fourth point. I didn't even realize I put that in. Like I did feel like I put it in, but I didn't read it. This layered patient approach helps create more lasting results, allowing for the body to naturally unwind at its own pace and for the most complete and comfortable outcome possible. Circling back is really big, especially in animals where it's a animal that has a lot of tension that is presenting, especially when you're kind of dealing with new patients or patients that don't maybe get seen as often as they should, is that you will often have things that have to repeat itself. And I mean, there's only so much time that you have with an animal, and there's only so much patience that an animal has. You're obviously not going to be intending to work on these animals for 4 hours at a time. You would be exhausted. But it's just that process and that thought process of going back to the areas and seeing how they're responding. So now we're going to talk about acupressure. This is probably one of my favorite modalities. I'm maybe a little bit biased because I teach it, but honestly, I just can't get over how outstanding this is. And I think it's my favorite because I think I've just seen it work in miraculous ways so many times. Like, especially because I won't even lie to you. If you told me like 8 years ago, before I maybe started on my holistic approach to things and my holistic journey and actually diving into these different modalities, if you would have told me that stimulating acupoints on the body um, has, an effect on so many things, like it can stop early onset of colic, it can help with pain management, it can help with anxiety, I probably wouldn't believe you, but it's absolutely outstanding, and I have seen it work so many times. I have seen our students graduate and then tell me about stories of acupressure, doing something miraculous, and I love it. It's one of my favorite modalities. Um, if you haven't explored it, even if you haven't read an article on it, there's literally a free ebook on the acupressure available on Holistic Animal Studies. Seriously, go download it. I really think you should. Acupressure in itself is really powerful, and it's deeply intuitive practice that works directly with the animal's chi, which is the vital life force that flows through all living beings. In traditional Chinese medicine, chi travels through specific energy pathways known as meridians, nourishing every organ, muscle, and system of the body. When chi becomes blocked, deficient, or excessive, the body's natural state of balance is disrupted. This imbalance can result from physical trauma, emotional stress, injury, or internal dysfunction, which, by the way, happens in everyone's everyday lives. Whether you're a human, whether you're a retired horse, it does not matter. Without restoring the flow of chi, true and lasting healing is difficult to achieve because the energetic communication that keeps the body functioning in harmony has been interrupted. Through acupressure, we help rebalance and restore this vital energy by stimulating precise acupoints located along meridians. Each acupoint has a specific therapeutic action, and actually most of them have 5 or 6 of them. It might move stagnant energy, it might tonify weakness, release heat or inflammation, or calm the spirit, among a million other things. Certain points can influence things far away. We call these like your your local points, or your points that are near an area that it's treating, and then you have your points that are farther away that treat the area as well. The result of stimulating these acupoints is a profound shift that supports the body's innate ability to heal itself. One of the most beautiful aspects of traditional Chinese medicine, and something that strongly resonates with holistic practitioners, is the understanding that everything in the body is connected. It's the biggest thing in traditional Chinese medicine that any text and any sort of modality that the Chinese essentially have created and wrote about, is that everything in the body is connected. There is no separation between the physical, emotional, and energetic layers. They continuously influence one another. This is huge. This is like if you open up your mind to traditional Chinese medicine, and if you have the ability to even study it in human context, it is huge. I don't even listen to it enough as I should as a human, especially like I'm carrying a baby right now, and it is just it's insane. Your emotions and your physical state are super connected, along with your functions of your organs. And I could just go on for days, but I'm not going to. When I select points and meridians to work with, my choices are guided by the assessment and presentation in front of me. So every meridian corresponds not only to a specific organ, but also to an emotional pattern, a psychological system, and sets or physiological system, and sets of external signs or symptoms. Sometimes these imbalances reveal themselves through muscular and joint functions, making acupressure an incredible bridge between energetic and physical therapies. For example, let's kind of just assess a horse with ulcers. It may appear to be a purely digestive issue, it may appear that the horse has ulcers because he's being starved 12 hours a day. I shouldn't say starved, but let's just hypothetically. We know in traditional Chinese medicine that it is also the digestive issue itself is deeply tied to the spleen and the stomach meridians, which govern digestion, nutrients absorption, and emotional grounding. So I'll focus my points on soothing the stomach and strengthening the spleen and calming the nervous system to promote internal healing. Externally, these imbalances may also express themselves through tightness in the brachiocephalicus, the pectorals, the abdominals, and the longissimus. Abdominals is kind of a given. Most horses who have ulcers are usually quite tender in those areas. But if we assess those other areas that are presenting as well through massage or myofascial work, in conjunction with acupressure to restore both energetic and structural balance. Acupressure at its heart is about listening, not just with your hands, but with your intuition. It allows us to see the body as a complete ecosystem where every imbalance has both a story and a solution. When chi flows freely once again, the body's natural rhythm of healing and harmony can finally take place. So here's just a few examples of where I talk about how acupressure manifests as something like physical and externally, besides just the fact that the chi runs through the internal. So, common presentation in horses is restricted shoulder movement or shortened stride in the forelimb. Often, the brachiocephalicus, trapezius, and pectoral muscles are tight and shortened, limiting extension. That's kind of where our brains go as a practitioner when we hear or see a shortened stride in the forelimb. From a traditional Chinese perspective, these areas correspond closely to the large intestine and small intestine meridians because they run through these areas. In this case, I might begin stimulating specific points like the large intestine 1-5, which relieves shoulder pain and promotes mobility. Small intestine 9 and 10, these reduce tension in the shoulder and neck region. Bladder 11 supports the postural balance and movement, and gallbladder 21 encourages muscle relaxation and releases trapped chi. I might start with light myofascial or effleurage strokes to warm the tissue, then hold these acupoints for 30 seconds each using gentle circular pressure. This combination not only softens the fascia, but it restores the proper chi flow along the meridian, often resulting in visible release like stretching, yawning, or licking. Then we can move on to something like ulcers or poor appetite. For a horse or dog presenting with digestive upset, ulcers, or poor appetite, my focus turns to the stomach and the spleen meridians, which work in harmony to regulate digestion, nutrient assimilation, and emotional stability. In this situation, I'll work along stomach 36. This one is a huge point, one of the most powerful points for boosting chi, appetite, and overall vitality. This is also a really big one if we're dealing with colic. Spleen 6. Strengthens the digestive system, helps rebalance the fluids. Another really key point in colic. Bladder 20, which supports the organ function and relieves excuse me, sorry, and bladder 21, sorry, both of those, they support the organ function and relieve discomfort. And then controlling vessel harmonizes the middle burner and soothes the stomach. These points not only ease physical symptoms but also address the root cause, often stress or worry, which can stagnate qi in the digestive system. Following acupressure, I might use gentle abdominal massage or cupping along the stomach meridian to help release fascial tension or over the abdomen and promote deeper circulation. So now I want to get into the bonus modalities. We've talked about the kind of three big modalities that I commonly are my starting points, and then we're going to talk about the bonus modalities. So the bonus modalities to me are like those extra modalities that aren't really a requirement in a session. You can get results from your treatments without these, but these really enhance those sessions. They really take your care and your expertise to the next level. They allow another layer of tension to be released. They allow you to treat that animal completely yourself. If you go back to the very beginning when I was talking about referral systems and everything like that, it allows you to be that animal's sole caregiver, because there is a time and a place when these modalities do come into play and are sort of a requirement, because yes, massage and myofascial massage and acupressure, they do wonders. They really do. But like, for example, just very basic red light therapy. That one has such a powerful effect on cellular regeneration and the stimulation of ATP in cells and blood flow and pain reduction for like arthritis. So with a horse presenting with chronic arthritic issues or an injury in the tendon, yes, acupressure is going to address those issues, but red light's really going to heal that area. Then you go on to kinesiology taping, one of the most powerful modalities in proprioception. If you have a horse with, let's talk about a foal, for example, that's growing incorrectly, you can do massage and everything, but truly kinesiology taping is what's really going to help with that posture and that proprioception to help that foal grow properly. It's also something that works every day, because if you put it on the animal, it stays on until it falls off and it continues to work until it doesn't. So that's kind of where kinesiology comes into play. And then you have, your other things. One big thing like cupping therapy. Cupping therapy is one of those modalities that, because we're using a tool, this really helps us get deep into those fascial layers, deep into those areas that are really, really restricted. Can you do that manually? Yes, but it's going to take a lot of time and it's going to take a lot of effort on your part. These modalities help with your effort, and it also helps you treat multiple things at once. So let's get into the red light laser therapy or cold laser therapy, kind of both. These red light therapy has been another one of my favorites. It is by far frequently integrated in a lot of my sessions. I use it for pretty much anything. Tissue healing, relaxation, circulation. If I know an area has some inflammation and some arthritis, I love using red light therapy. I will often use it in areas that there's a lot of chronic tension, restricted movement. Those are obviously very commonly the pole, the neck, the back, and the SI region, as well as common sites of stress and compensation in many animals. Those are the top ones. I use pad-based red light systems because it allows me to work simultaneously on other parts of the body, maximizing my session efficiency and providing continuous photomodulation to the area of concern. So this just means like if after I'm done my, assessment and palpation, maybe I immediately, I'm going to work on that pole and I release that pole and then I'm going to put my red light on there to help it continue to release. Or I see that the SI lower lumbar area is really, really tight. I know I'm going to need to work on that area. I'll put a pad on that area right away to kind of soften it and get the circulation going before I start to manually release it. The gentle wavelengths of red and near-infrared light penetrate into soft tissue. They stimulate the cellular repair, increase oxygenation, improve microcirculation, which I kind of mentioned before. This can make manual therapies a lot more effective and easier to start, hands down, because you're placing, so then, you go back to fascia. Fascia responds to warmth. Any sort of repair, red light therapy is going to offer some warmth. They are going to increase oxygenation to the area. So it's going to start doing that already before your manual work. I have to pause, there's a bug. Okay. Red light therapy is especially beneficial in cases of chronic tension, arthritis, inflammation, or muscular fatigue, as it helps soften the tissue and reduce discomfort before hands-on work begins. That's what I just kind of mentioned before. When used as a standalone therapy, I often will pair it with lymphatic massage to enhance detoxification and fluid movement throughout the body, while the light focuses on a specific area of concern. This is kind of going back to foundation always being, massage always being the foundation. Even in like a red light therapy session, I'll still do some sort of massage. For cases that involve injury, trauma, or post-surgical recovery, I often will recommend a series of red light only sessions, ideally performed daily or every other day, to maintain continuous tissue repair and reduce inflammation. The cumulative effects of consistent sessions often lead to faster recovery, improved comfort, and better mobility. In every application, red light therapy works synergistically with other modalities, enhancing not only physical healing, but overall relaxation and well-being. Kinesiology tape. Kinesiology taping is another one of my favorite modalities that I kind of call my finishing modality. It's often described as something that I kind of leave behind with the patient to continue working after the session has ended. It's kind of like one of those modalities that works really great because it continues to affect the animal even after your hands-on therapy is done. As we talked about in any session, there's a limited natural time limit to how much the animal can process and comfortably release. Most horses, for example, do best within a 60 to 90-minute session, and kinesiology tape allows me to continue to support tissue recovery and balance beyond that time frame. I typically apply it to areas that feel particularly stuck or restricted, and areas where there's tension patterns, fascial adhesions, or joint restrictions are still present but beginning to soften. For example, with a horse that presents with an extremely tight back due to saddle fit issues, taping along the top line can help maintain circulation and support the fascia as it remodels between sessions. Similarly, applying tape around sore joints such as the patella or knees helps stimulate blood flow and lymphatic drainage, reducing stiffness and encouraging better range of motion as the horse moves naturally. I also use meridian taping, particularly when I find energetic stagnation along a specific pathway. This involves placing tape along the course of a meridian using minimal to no stretch, and it provides gentle, prolonged stimulation that encourages the flow of chi, energy, long after session ends. I often use inexpensive, like light duty or like literally cheap tape off Amazon because it allows for really easy removal. The stick is a lot less, so even if it falls off in the paddock in a couple hours, that's completely fine. It's because I just want it to hopefully come off quite easily for the owner and the horse so that it doesn't obviously hurt when trying to remove it. You have to think of a meridian taping as clearing a traffic jam. When energetic blockage or an accident occurs along a meridian highway, the entire flow of energy, much like traffic, begins to back up. Even after the initial blockage is addressed through acupressure, residual tension remains further along the route. The tape acts as a gentle guide, keeping that highway open and flowing smoothly between cities, which is your organ systems and tissues. This is an example that I always put together in the acupressure course, and when I'm teaching owners about acupressure or teaching practitioners, is that we view the meridians and the energy flow throughout our bodies as kind of like the highways of our body. So essentially, if you were to think of like how does acupressure work and all the effects on the body, if you think of like how there's so many different towns and cities and we're all connected by roads because we all travel by car. Okay, so there's really only, one way in, one way out for the most part, right? Obviously, yes, there are freeways with 5 lanes and etc. But we're just talking simple terms. Say you live in a really small town area where there's, one highway, one way in, one way out. So, traffic. Everybody's got to get to work. Everybody's got to go get groceries. Everybody's got to bring their kids to school. So if there's an accident that blocks the whole highway, well, now everybody's stuck in traffic. That happens all the time, right? But if the police and the ambulances and the fire trucks and the tow trucks never showed up to clear up this accident, well, everybody would just keep clogging up traffic. Everybody would be backed up, and you'd be backed up from town to town to town because people would just keep coming and coming because they have to get places, but that accident is still blocking it. The work of acupressure and working along acupressure, well, that is what is the tow trucks and the firefighters and the ambulances. They're there to clear up that accident so that energy can get moving. But if that energy has been blocked for a long time, well, you've got a lot of cities and you've got a lot of traffic that's been backed up for a long time. It's going to take some time to get that traffic flowing smoothly again. So that's kind of where this comes into play. So there's different taping strategies with kinesiology taping. There's, each taping application is intentional and based on the area of the concern and the presentation of the tissue. There's fascial braiding tapes, which are used when I want to create a really thorough tension release across restricted fascia. It's aimed to gently unwind the layers that have adhered or twisted due to compensation or chronic strain. So these are often areas like maybe I've done my myofascial massage work and those areas are just still kind of tight and restricted. I'm probably going to use a fascial sort of braid or a fascial wave along that area to continue to work that fascia after I've gone. I call them a star or web tape, ideal for localized inflammation, bruising, focal tension. The crisscross pattern specifically will lift the skin microscopically, obviously, and promote that circulation and lymphatic drainage. That's really great for scar tissue injuries. The star taping I might use more so on maybe the SI, or something like that where I want that multi-directional lift as well. Meridian tapings, as mentioned, are for energetic balance and prolonged chi stimulation, and then supportive or decompression tapes. So this is kind of when you're placing them maybe for joint stabilization, postural correction, or just general recovery support. So there's all sorts of different types of taping. A common one too is I'll place an anchor at the pole, and then I'll bring one piece of tape right along the nuchal ligament, and then I'll bring another piece of tape down the brachiocephalicus, and that's a really common one that I'll do for neck support. That's just a nice, sorry, that was the couch. That's just a nice decompression taping. It's just getting that area moving. Each taping method is chosen to enhance the body's natural healing process, not override it. The goal is always to support continued improvement between sessions, keeping the animal comfortable, balanced, and progressing in the right direction. Now we'll talk about cupping. Cupping, which is also called myofascial decompression therapy, is one of the most unique modalities that I use and that I teach, primarily because it works through decompression rather than compression. Unlike massage or myofascial release, where we push into the tissue, cupping gently lifts and separates a layer of fascia, skin, and muscle, creating space for blood flow, lymphatic drainage, and cellular repair. This decompressive approach allows the practitioner to reach deeper restrictions without adding additional pressure to already tense or guarded muscles. It can be incredibly effective for releasing fascial adhesions, increasing circulation, and restoring normal glide between the soft tissue layers. In my practice, cupping is always case dependent. Some animals, especially those that are anxious, shy, or highly sensitive, may not tolerate cupping well in their first few sessions. In those cases, I may introduce it gradually or avoid it altogether until trust and tissue response have improved. However, for many animals, in most cases, this deep-seated muscular tension that often comes up, chronic postural issues, scar tissue, cupping can make a difference significant both in comfort and mobility. Because cupping works so deeply, placement and duration are key. I generally focus on larger muscle groups or regions where the fascia feels wound up or resistance to manual work. Common treatment areas include the back, the gluteals, hamstrings, shoulders, and along the thoracic fascia, regions that often store long-term tension or compensatory strain. The goal is to always facilitate decompression where the body needs it most, not to overwork the tissue. This is really, really key. I think of it cupping as an extension of my hands, like I've talked about before. It continues the release process I initiate manually, but with a slightly different mechanism. While my hands can apply pressure and sense feedback, the cups allow the body to gently lift and unwind itself from within. There are several techniques that I may use depending on the case, which would be stationary cupping. These are over maybe specific trigger points or fascial restrictions, and I left for a few minutes to create a deep localized decompression, gliding or dynamic cupping, where I move the cups along muscle fibers or fascial lines to encourage mobility, tissue hydration, and lymphatic flow. And then pulsed cupping, used for more sensitive patients or near delicate structures, allowing gradual decompression and circulation enhancement without overstimulation. When performed thoughtfully, cupping can enhance the results of every other modality, particularly myofascial massage, kinesiology taping, and acupressure, by preparing the tissue, improving circulation, and promoting a deep sense of relaxation and release throughout the body. When incorporating cupping into a session, one of my favorite ways to blend Eastern and Western approaches is by working along the back shu points, a line of powerful acupoints located on either side of the spine, corresponding to the major organs and systems of the body. From a traditional Chinese medicine perspective, the back shu points are where the qi, vital energy of each organ surfaces and connects directly with the body's energy field. This makes them ideal for influencing internal organ function, promoting balance between the physical and energetic systems, and supporting the body's overall vitality. From a myofascial and physiological standpoint, these points also lie along the paraspinal and thoracolumbar fascia, areas that are often dense, protective, and prone to restriction due to postural strain or compensation. Cupping over or near these points allows for decompression of the fascia, improving both circulation and energetic flow. And also, I didn't write this down, but because they tie into the organs, it also allows for a really important detoxification effect. This dual effect helps release muscular tension while also encouraging the body to regulate its internal organ systems, making it a powerful addition to any holistic treatment sessions. Each back shu point corresponds to a specific organ and can be targeted depending on the animal's presentation. So here's some examples. So the bladder 13 is on the third thoracic vertebrae, and cupping here has can assist with respiratory tension. So if there's restricted breathing patterns or emotional grief and anxiety, because the lungs are actually tied to grief in traditional Chinese medicine. Bladder 15, this is around the fifth thoracic vertebrae. This point helps circulation, emotional balance, and overall vitality. Bladder 18. This is an excellent point for stiffness, irritability, and fascia that feels stuck or ropey, as the liver, because this is the one that connects to the liver, governs both smooth movement of energy and tendons. Bladder 20, connected to your spleen, helps with supporting digestion, nutrient absorption, and lymphatic drainage, and can be used when working with sluggish fascia or postural fatigue. And then bladder 23, which is your kidney point. This point supports lower back, hind end, and SI joint health, as well as overall energy reserves and recovery. So while it influences the kidney organ, it also has all of these additional extras, and that's kind of where I talk about that really each acupoint has like 5 or 6 different things that it affects. When we work along the back shu points, I typically will use gentle stationary or gliding cupping depending on the patient's comfort and tissue tone. For sensitive or thin-skinned animals, I often will use dynamic cupping with light suction moving along the bladder meridian to encourage energetic flow without overstimulation. For deep, tense, or stagnant fascia, maybe the animal presents with really needing a really big detox and maybe those muscles are just naturally really tight, I'll use stationary cups. With slightly stronger suction, place briefly over specific shu points to open the channels of decompressed tissue. So this is like right next to the spine along the multifidus muscle. Cupping over the back shu points can also be combined with acupressure or red light therapy too for amplified results. The suction stimulates the fascia and chi flow, while red light or manual pressure activates the acupoint itself, deepening the therapeutic effect. Back shu points are commonly used in cases of chronic tension, digestive or organ-related imbalances, emotional stagnation or stress-related conditions, and horses with just generally poor top line or stiffness in the back. Aromatherapy and essential oils. Aromatherapy is one of the most underappreciated yet profoundly powerful tools in holistic animal care. While it may not always be received as much while it may not always receive as much attention as other hands-on modalities, the impact of essential oils on both the emotional and physical state of an animal is undervalued and undeniable. Essential oils are volatile compounds extracted from plants that carry their life essence, their chi, if you will. They interact with the body in 2 ways: through olfactory stimulation, which is influencing the limbic system, such as the emotional center of the brain, and through topical application, where their constituents can be absorbed through the skin to provide therapeutic effects on muscle, circulation, and internal systems. I often will begin my sessions by diffusing or simply opening a bottle of calming or grounding oils, allowing the animal to inhale and decide for themselves how close they wish to engage with the scent. This subtle introduction helps the animals settle into the space, promoting a sense of safety and relaxation before I even lay a hand on them. Oils such as lavender, frankincense, and Roman chamomile are often my favorites for this specific purpose, each offering emotional release, grounding, and a gentle unwinding of nervous tension. This is often when I am maybe presented with an animal who's maybe a little bit more nervous. This is maybe where I might use aromatherapy. In acupressure sessions, I often will actually integrate essential oils directly with the points being stimulated. Because each oil actually carries a distinct signature, pairing them thoughtfully can enhance the desired outcome. For example, lavender, because it's naturally already a calming oil, using it on the calming point of the body, which is yin tang, it helps to really promote that emotional calm and mental clarity. Peppermint is that's a really powerful essential oil used for both pain properties but also for digestive properties. This might be used on stomach 36 to boost vitality, circulation, and digestive function. Marjoram is an antispasmodic one that is really, really commonly used in any sort of muscular issues. This used on gallbladder 21 can ease muscular tension and promote relaxation through the shoulders and the neck. Essentially, the essential oils are just sort of used to heighten and stimulate the acupressure itself. That's why we teach it in the acupressure certification course, is because using them in conjunction with the acupressure can kind of just enhance everything. I also like to use essential oils topically during my massage sessions intentionally. So it's kind of similar to raindrop therapy, but not really raindrop therapy because raindrop therapy is an entire modality itself. But it kind of is adapted to the animal's comfort and needs. So I might choose specific oils that pertain to what that animal is presenting with, diluting them, on my hands or pre-diluting them and massaging them gently in the different areas that I might be working on, such as really commonly in the paraspinal muscles, because I can influence the nervous system and the energetic flow of the meridians as I travel along the back while doing my massage. Depending on the different goal, I might choose maybe more warming antispasmodic oils such as marjoram, ginger, or black pepper to support really tight, sore, fatigue muscles. Or if I'm finding that I really need more of a detoxifying, maybe a respiratory supportive oils, I might use eucalyptus or cypress to encourage the lymphatic movement and deep breathing. The key with aromatherapy and animal practice is intent and intuition. Offering the scent, observing the animal's response, and allowing them to guide the experience. That's a really big thing that's taught in the aromatherapy courses, is essentially the animals being able to choose their essential oils that they want. When used thoughtfully, aromatherapy bridges the gap between body and mind, engaging both the physiological and emotional layers of healing. Raindrop therapy. This is one of those modalities that I really love to integrate, not just because of the results, but because of the energy it carries. It's truly a beautiful blend of aromatherapy, massage, reflexology, and meridian theory, and it works in a way that feels both physical and deeply energetic. The concept behind raindrop therapy is rooted in the belief that toxins, both physical and energetic, can accumulate along the spine. The spine is the body's main communication highway where the central nervous system and energetic meridians intersect. When this channel becomes congested, it can influence not only movement and posture, but also immune function, mood, and overall vitality. By gently applying essential oils along the spine, we're supporting detoxification, encouraging alignment, and helping to restore balance through the nervous system and meridian pathways. This technique was actually originally created by Dr. Jerry Gunn, and the course has been the original raindrop therapy is used, was actually originally created for human patients with scoliosis, and then it's been adapted for horses, um, slightly, obviously by using neat oils, using a little bit different techniques, and that's kind of where the raindrop therapy certification course comes into play. And we also have owner courses, is because we also kind of changed it a little bit in response as well to the meridian theory behind it. But anyways, he observed that the essential oils, when combined with gentle massage and reflex techniques, could support spinal alignment, reduce muscular tension, and help improve overall mobility. Over time, it evolved into a deeply restorative and immune-boosting therapy used for both humans and animals alike. Because all of the essential oils work really, really well for doing beyond just the muscle part of it, but because they do also offer, a lot of them have antibacterial properties, and when they're absorbed, they help get rid of toxins. During a raindrop session, a series of therapeutic grade essential oils are lightly rained or dropped along the spine and feathered out using a sequence of strokes inspired by Lakota feathering techniques. The oils are chosen intentionally, each one offering its own healing purposes. So we have oregano and thyme, basil and marjoram, cypress and wintergreen, peppermint, valor, which is a blend of essential oils. That's called like a chiropractor in a bottle. That's a big, big one. Um, and I'm missing one here as well. What am I missing? What am I missing? Valor. No, maybe that's it. No, there's 8 oils. Yeah. As the oils penetrate through the skin, they begin working through the tissue, supporting circulation and releasing stored toxins. Because animals are incredibly sensitive to energy, I always take time to read their reactions during this, watching for subtle releases like licking, chewing, deep breaths, or softening through the top line. I also find this is another little kind of side off is that when I'm doing raindrop therapy, I really pay attention to what oils are coming out of the bottles faster because it's believed that the oils that the animal needs will naturally be pulled from the bottle faster than other oils. Obviously, viscosity of different essential oils is a factor, so that's kind of, you have to take that a little bit with a grain of salt, but that is kind of what it's believed with. Raindrop therapy also is something that continues to work even after you are done with the patient because essential oils will harbor in your body and circulate through your bodies for up to 7 days. So your skin absorbs absolutely everything that you put on it. So the raindrop and the essential oils are absorbed through the skin of the horse or the dog, and they are continuously cycled through the body and cycled through the bloodstream and kind of essentially benefit the animal for days to come. For horses in particular, raindrop therapy can be especially beneficial in cases of chronic back or SI tension, stiffness along the spine, poor immune health, or even after illness, medication, or emotional stress. It's really great for dogs after vaccines, surgery, antibiotic treatment. It's also beautiful for those who carry tension in their posture, so the ones that are always on guard or bracing through their back. I often end a raindrop session with gentle acupressure and bladder meridian strokes, encouraging the oil's energy to integrate throughout the system. The transformation that follows can be incredible. You'll often actually see the animal's body soften. You might even see them get taller because of their postural change, and they breathe deep and a calm awareness washes over them. Craniosacral therapy. This is a truly gentle yet profoundly powerful modality that I incorporate when an animal system feels stuck in a deeper way, not just muscularly, but neurologically and emotionally. Craniosacral work focuses on the subtle rhythm of the craniosacral system, the membranes and cerebrospinal fluid that surround and protect the brain and spinal cord. This rhythm is like the body's internal tide, and when it becomes restricted, it can influence everything from movement to behavior to organ function. What makes this modality so fascinating is how subtle it is. With light, intentional touch, often no more than the weight of a nickel, we can begin to feel and influence the craniosacral rhythm. The practitioner gently works along key areas such as the cranium, spine, sacrum, and even the TMJ to release restrictions and restore balance to the nervous system. When that flow is reestablished, it's like the body exhales. Tension softens, the mind calms, and true healing can begin. Craniosacral therapy can be particularly beneficial for animals who have experienced trauma, chronic tension patterns, head shaking, bridle or bit resistance, pull tightness, or unexpected behavioral changes. It's also wonderful for horses recovering from injuries or those who seem off even when their body appears sound, because often the restriction lies in the deeper fascial and neural layers, not just the muscles. This is more of that connection to the nervous system that is huge. One of the things I love most about this modality is how much the animal guides the session. You don't force anything, you just listen. The body tells you where it's holding and when it's ready to let go. Sometimes that release comes with a sigh, a yawn, a gentle shifting of weight, and other times it's deep stillness that washes over them as the nervous system resets. When I work with cranial sacral therapy, I often integrate it with other modalities like acupressure or red light therapy to help the release go even deeper. The goal is not just to relax the body, it's to reawaken communication between the brain, the spinal cord, and every system that they influence. It's incredible to see the changes after a session. A horse that was once anxious or reactive softens and connects. One that struggled with balance or coordination starts to move more fluidly, and sometimes even old emotional patterns begin to lift. In essence, cranial sacral therapy helps bring the body back to its natural rhythm, that quiet, balanced state where healing can truly take place. It's gentle, non-invasive, and deeply intuitive, making it one of the most profound tools we have as holistic practitioners to support the both physical and emotional well-being of animals we care for. Gua Sha. Gua Sha. This is one of those tools that looks simple at first glance, but when used with the right intention, it can create incredible changes to the body. I tend to reach for my gua sha tool when I feel an area just isn't letting go, when the fascia feels dense, the muscles aren't responding fully to my fascial work, or when there's physical stagnation in the tissue. like tight bands, like a movement, or even that cool to the touch feeling over certain muscles. Gua sha, which originates from traditional Chinese medicine as well, literally means to scrape stagnation or to scrape sand. It's a technique that increases microcirculation, breaks up fascial adhesions, and helps move stagnant blood and energy that's stuck in the tissues. In animals, I use it with very gentle hand and a close observation. It's never harsh or forceful. It's not like the human ones where you see the gua sha and it's like everybody's blood vessels are broken after. That's not what we're doing. The goal isn't to create irritation, but to restore flow and elasticity to the tissues. I'll typically bring gua sha into a session after the muscles are warm, usually following massage or red light therapy. So the fascia is pliable and responsive. From there, I glide the tool slowly along the muscle layers and fascial planes, and I also might use it like in a fast back and forth motion when I'm specifically trying to work out the fibers. Areas like the longissimus dorsai, the gluteals, the neck, and shoulders are some of my favorite areas to work with it because that's when I find that that's where I find there's restrictions, and then releasing it helps with the animal's movement patterns. You can actually feel the tissue change underneath your tool, and it actually can be used as a palpation tool as well. Some practitioners who use gua sha or blades might use it as a full body palpation technique so that they have a way of essentially heightening their um, they're like heightening where they feel those stress points or those fascial restrictions. It takes some time to practice that, but once you do it, it actually almost acts as like a magnifying glass for it. I often will use gua sha as part of my myofascial work because it'll help me access those deeper layers and also help me just manually be able to release any sort of like scar tissue or fascial adhesion in an area a little bit differently than I would with my myofascial work. I'll use it on horses dealing with chronic tension, old scar tissue, or postural imbalances such as an uneven shoulder, development or tightness along one side of the back. It's also really incredible for helping animals unwind those areas where fascia seems to pull or twist through the body. I actually used gua sha specifically on my horse who had an extreme tight neck after a vaccine, and it was the first time he's ever had a reaction to a vaccine where it was poor, where he was really sore. And so instead of doing any sort of manual work, because to him that was just too much, I ended up red lighting the area and doing my gua sha along his entire neck. And within literally 30 minutes, he was able to put his head down a lot better than he could beforehand. To me, gua sha is like giving the fascia permission to breathe again. When it's used thoughtfully, it blends seamlessly into any myofascial session, amplifying results and helping the body release in a deep, more complete way. So now let's put it all together. We've talked for over an hour and 20 minutes on different modalities. So now that you've learned all the different modalities and the thought process behind them, let's dive into some real life case studies and we'll walk through why, what, where, and when of using each modality both individually and in combination. This is where everything comes together, where the theory meets the practice, and you'll get to see how blending modalities can create deeper, longer lasting results for the animals we treat. So here we've got a 23-year-old gelding using English pleasure presented with a history of bucking during resistance, a reluctance to lift through the back, and his owner had noticed tension over the longissimus dorsi and SI area. Saddle fit was assessed, and it does fit nicely. During palpation, there was clear sensitivity and tightness along the thoracolumbar junction, tension in the hamstrings, and limited lateral flexion in the neck. The horse guarded his back during deeper palpation, which is classic signs of chronic compensation. His eyes were soft but watchful, indicating some discomfort but willingness to participate. I located some stress points along the withers, and there were active trigger points in the T3, 13 to T16 areas along the longissimus. Significant releases happened upon assessment of the stifle. So what did we do? Well, we did massage because we're preparing the tissue, increasing circulation, and it also allows for a vital assessment on the fascia and the muscles and to invite the nervous system to relax. Then we moved on to myofascial techniques. Once I felt like the tissue was a little bit more pliable, I immediately transitioned to myofascial release, really targeting the longissimus dorsi and the gluteals. I used my opposing directional sweeps, cross fiber holds, and I was really trying to encourage and lengthen the fascia to restore the glide along the neck. The fascia over the lumbar region felt especially dense, so I worked slowly, allowing the tissue to dictate. I did skin rolling along the stifles, feeling fascial adhesions actually beneath my fingers, because that's what skin rolling can allow you to do. And then we did some C-strokes bilaterally along the neck, finishing with pectoral releases. Following the fascial workup, I integrated some acupressure at bladder 23 and bladder 25, and then I also did governing vessel 4 at the lumbosacral junction. So this was to support the chi flow. I wanted to nourish the muscles of the back, reduce the stagnation, calm the spirit, especially because he was resisting through his top line. Once the fascia had released, I applied some silicone cups along the longissimus dorsi and the gluteal muscles for about 10 minutes in static placement. It provided a really deep decompression, which allowed the animal to just generally just benefit more from the session. To finish it off, I placed the red light therapies over the SI region and lumbar spine for 20 minutes while I performed a lymphatic massage. And once I actually did my lymphatic massage, I also did some work along the bladder meridian as well. I did a slow trace along it bilaterally as those pads kind of finished up their time. In general, really big releases from this guy. On his reassessment, his back was significantly softer. His owner reported willingness to round and lift through transitions within just a few days. I gave the owner some stretching homework for the back and neck, which she did repeat daily. So now I'll explain why I didn't do everything that I can offer and why I chose what I did. I didn't feel essential oils were required for this session because it was extremely musculoskeletal that it was presenting with, and the fascia was quite tight, and that was quite dehydrated too, which was my main culprit. He was also already willing to release and relax just from my initial palpation, so I didn't feel like he needed that additional support. I did not end with kinesiology tape along the back or SI because I wanted to get a true reassessment of the fascia in 2 weeks' time when I booked her back for her retreatment, sorry. I wanted to see what responded well and what didn't. Sometimes the kinesiology tape, especially for new patients, can sort of hide that because the kinesiology tape obviously is so beneficial, but I wanted to see kind of how this horse would do. Along with that, it was quite hot out. This was in the summertime. The horse has a naturally oily coat. She probably uses different show sheets as well. So I just knew that probably the kinesiology taping just wasn't going to last. Cranial sacral therapy was not used in the session because the tension did not seem to be deep-rooted or stuck in a particular area, especially when I got releases by simply doing my assessments. However, I did reassess, obviously, at my second appointment and my third appointment to see if if CST was going to be required. It never really was. He actually released quite substantially. Within 3 sessions, he was wonderful. He was being ridden back to normal, and then we just continued routine maintenance. I did do a lot of myofascial release because the tension was presenting very much in his fascial patterns. Acupressure was used to sort of treat any sort of systemic balance potentially causing the sore back because the saddle wasn't causing the issue. And I do think it had wound up over time. I think that there was something that had happened to this horse, whether it be a bad ride or he had a fall. He had something that was hurting him and it wound up over time. He also had not been treated for several months. There was a little bit of inconsistency with his treatments. One thing I did mention when doing my summary is that I did go back and forth between the areas he was presenting tense with. So this is kind of where I was talking about where I'll go to one area and I'll go back to another area. I was kind of switching. I would release along the longissimus and the gluteals, and then I would go to the neck, and then I'd go back just to make sure that he was actually releasing. That's kind of a big reason why I didn't do red light therapy. in one area right off the bat and why I did it at the end of the session. Not really, I didn't really discuss this, but doing the stretches and giving owners like homework is really beneficial for the animals, and it helps the owners feel really empowered and part of their animal's recovery and treatment. Next, we're going to talk about Xena. Xena is a name I came up with. This is not the horse's name, but she was a really gorgeous, like warm blood mare, high dressage horse. Very sensitive though. The owner had reported she had become really unpredictable in her saddle. She was displaying signs of spookiness, crow hopping, and resistance to collection. Um, she was very, she was described as being on edge all the time, even during grooming or attacking, and she was growing a reluctancy to stand quietly or move forward freely. She was also a horse that like would come up and kind of be excited to get ridden, and she was hiding and running away. So these changes suggested more than just a physical discomfort. This to me presented to be some sort of emotional and energetic imbalance stagnation, um, which often tension from the spine or blocked meridians or digestive disturbances can really affect these. So I began with a calming and a grounding approach. So this is where I use my essential oils actually. I had a diffuser that I bring, and with Barn's permissions, I will diffuse the barn. And it was the winter time, so we had the horses inside, and I was able to work in an area where their diffuser was. And I was working on multiple horses in the barn that day, so I actually had the diffuser going on through the whole day, which really benefited her. And I chose to do her last for this specific reason, so that she was in her stall and she was actually getting these essential oils for an hour before I actually started to treat her. The goal at that point was to create sort of a safety and relaxation for her before I actually began my hands-on stuff. I started with light massage and myofascial warm-up. I focused on her poll, her neck, and her shoulder regions, and then I transitioned to acupressure pretty quickly, which served as my main modality for this session. Based on my assessment, I selected 10 acupoints. I worked closely along the bottom meridian to influence her autonomic nervous system especially, and to release tension along the spine. I also did some digestive points and some immune points, and I focused in on governing vessel 20 to help calm the mind and support focus. I did a couple more than this. I actually have a bunch of protocols that we actually use in the acupressure session, and I didn't write it in my notes, but I'm pretty sure I did an actual acupressure session for releasing emotional stagnation, which incorporates a bunch of different acupoints I can't name off the top of my head at this current moment. But I do believe we did do an acupressure protocol like that on top of these points, just because she was having a hard time, and there wasn't specifically a myofascial pattern or a massage reason that was contributing so much to her sudden change of behavior. These points that I chose in the above mentioned were specifically because we move them along the spine. It helps the internal organ function and promotes the emotional grounding. I also used photopuncture, so that's when I use my red light therapy torch to apply to the acupoints to amplify the energy movement and cellular repair. So this helps to create a deeper release. Also, it gives the benefits of using red light therapy along with acupoints and acupressure, because red light therapy doesn't need a lot of time to actively work. And by using red light therapy, I was able to do kind of a 2-for-1. That's kind of what photopuncture is, in lack of a more in-depth explanation, which there is obviously a better explanation, but yeah. Zena's initial muscle twitching around the lumbar region softened noticeably after several minutes of photopunction along her bladder meridian. So this suggested that there was a response to her decompression and energy flow restoration. I also applied essential oils topically along her spine. I used valor and marjoram, which promotes spinal alignment, relaxation, and detoxification. It's widely believed that toxins and emotional stagnation can accumulate along the spine, like we talked about in brain therapy. So I decided to just kind of give her a quick one. So I applied these oils here. By the end of her session, she had visibly softened. Her head carriage dropped, breathing slowed, and she stood a lot more squarely. However, because the tension initiated deep releases and detoxification, I did actually schedule her for a follow-up range up this session in a week. I felt like she really needed some sort of reset in her general body. She needed like a good detox, and then I hoped that hopefully that range up session in my head at that point was going to hopefully allow me to get a different response from her at her repeat sessions. So then, to finish, I applied kinesiology tape around her thoracolumbar fascia and her SI region, just using a standard decompression therapy, just because of the fact that she was having a hard time with her engagement. By the end of the treatment, Xena was a lot more grounded. Her owner said that this was the calmest she'd seen her in weeks, and we booked her for a follow-up range-up therapy session, and then we ended up doing a lot more acupressure on her. We did acupressure-based sessions for 2 weeks. Not for 2 weeks straight, sorry. After her range up session, I got her back 2 weeks later. We did another acupressure session, a little bit more myofascial work, and then she was back to normal. You probably are asking, why didn't I do craniosacral therapy? At this time, with this mare, I did spend a lot of my time with acupressure because she was so sensitive during my initial visit. I didn't want to lose her. So craniosacral therapy does take some time, and it does take the animal some time to really get into it. She wasn't completely relaxed, so I didn't feel like if I took the time to work along her craniosacral rhythm, doing the 10-step protocol, I felt as though it was not going to benefit her the way that I wanted it to in the time that I had with her. I knew her window was going to be short. I knew that I needed to work diligently on trying to address the internal imbalance that was going on with her and trying to find the root cause of that. Craniosacral therapy would obviously be beneficial for this horse, but not in this kind of circumstance, especially because she was in the barn already for an hour. The essential oils were helping her, but she was still, like the owner reported, kind of unpredictable. She was moving around a lot, etc. That's why we didn't use the red light therapy on her. It took her a while to get relaxed, and she was moving around a lot. She was kind of pawing at the beginning of the session. And so I used my red light for stimulating the acupoints instead in hopes that that would benefit her. Cupping was not used with Xena because she was just too sensitive for cupping. To be very straight up sensitive, she was sensitive, and cupping was not going to work for her. While myofascial was my starting point, I didn't intentionally spend too much time on this because I really needed to internally figure out her chi in sort of to get any sort of progress through. When horses are emotionally unbalanced and there's something beyond the muscles going on, their fascia is going to continue to suffer until it was resolved. So once we were able to resolve her actual internal imbalance and where that was coming from, the myofascial work that continued on for her sessions was a lot more easier to do, and she actually held those treatment patterns as well. So that wraps everything up. This is a very long session, a very long hour and 40 minutes of me talking to you guys. I hope you guys gained some insight into rating modalities and seeing a practitioner's different point of view. I hope that you were able to take away the why and the when of modalities, although we didn't talk about it in insane depth. I did talk to you guys obviously about the whys and the whens as far as the case study goes, and I talked about one of my approach to the different modalities. If you ever have any questions about the modalities, if you have any questions about any sort of modality, because I do most of them, please feel free to reach out to me. I'm always happy to answer any questions that you have. I'm happy to help you with cases. Love doing that stuff. You can email me at stablemindandbody@outlook.com. So stablemindandbody@outlook.com, and my website is stablemindandbody.com as well, which you can send a contact information through as well. And you can kind of see all of my different sessions, and you can also just look on there for just general information if you need to. I hope you guys enjoyed, and have a great